Thanks for joining us today. In this module, we're going to present some important steps for deploying the Elegard patient positioning system quickly, efficiently, and correctly. Throughout the presentation, we'll be referring to the Elegard patient positioning system simply as the Elegard system or the Elegard. And this presentation is part of a series of educational videos that should be viewed together. In order to best understand this technique, you should really first be familiar with the science of head-up positioning in resuscitation and the operation of the Elegard system. You should also be familiar with your agency's specific equipment and protocols. And note that any benefits or clinical improvements discussed here are based on preclinical and limited clinical data. The preliminary field data shows a correlation between the time to Elegard placement and the chances of achieving return to spontaneous circulation, or ROSC. And here you can see that there's data from 5 agencies across the country with deployment times that range from 2 to 14 minutes. And sites that have the shortest time from first patient contact to deployment of the Elegard system have the highest ROSC rates. This is why our focus today will be on getting the system deployed most efficiently. Elegard users have shared their approaches to help reduce the time it takes to get the bundle of care deployed, and we'd like to start by sharing some of these techniques with you. The deployment of the bundle of care has been expedited by packaging the Elegard system with other first-in BLS bundled care items, including airway equipment like a bag valve mask, a supraglottic airway, and an impedance threshold device, or ITD, otherwise known as a rescue pod. You'll want to prep the Elegard system for its next use immediately after a call, so be sure to clean and disinfect it following your agency's protocol. Make sure it's in its lowest position and the CPR backplate is securely attached. Add a mega mover or similar soft stretcher. Providers have found that folding it in this accordion fashion and preloading it under the Elegard system makes movement off scene quicker and easier. Next, place the disposable cover on the Elegard. Using this disposable cover should make cleaning and disinfecting quicker and easier. And keep the cover above the lift handles and clear of the mechanical CPR attachment points. Gather your immediate BLS resuscitation equipment and place it into the Elegard device as shown. This includes the rescue pump if you use it, a bag valve mask, a supraglottic airway, an ITD, and a HEPA filter. Then secure the soft stretcher to the Elegard with breakable rip ties. Make sure you can still see the control panel so you can perform your battery checks when the Elegard's in its case. And then put the Elegard with this BLS equipment and soft stretcher into the Elegard backpack, zip it up, and you're ready to go. With this bundle of care packaged in the Elegard case, you can carry less and do more. Seamless execution of the entire bundle of care is critical. Smooth deployment can be enhanced by practicing as a team. Let's take a look at some of the critical steps and best practices of deployment. Upon arrival to a sudden cardiac arrest, you should always start high-quality CPR immediately. Position the Elegard system with airway equipment near the patient's head. Open the Elegard case and start airway management. While the rescuer secures the airway, or as soon as possible, apply the defibrillator pads and ready the Elegard by taking it out of its case and powering on.
Bernie, can you prepare the Elegard and the Lucas? Okay. Ivan, can we prepare the DD?
In order to make a smooth transition to the Elegard, make sure everyone is ready. Communicate your roles and call out the lift. Then place the Elegard system under the patient. This choreography should be practiced frequently as a team.
I'm going to stop compressions. Ivan and I will lift up. Bernie, you're going to slide under? Yes. On my 5, 1, 2, 3, 4, 5. And down. I'm going to continue compression.
The lift can be done by 1 or 2 people, with an additional rescuer placing the Elegard.
On my 5, 1, 2, 3, 4, 5.
Lift the patient by the arms or shoulders and support the head. For either a 1 or 2 person lift, make sure you lift the patient high enough to get the device fully under them. The nose of the device should be near the patient's waist. Bring the device and the patient down together, observing for proper placement as the patient's being lowered. You assess for proper placement using the attached CPR board as a guide. The top edge of the CPR board should be just below the armpits, with the center of the board at the nipple line. You should be able to properly attach the mechanical CPR system. If the patient's tall or has a long torso, you may need to extend the upper portion of the Elegard to ensure the neck support's at the base of the neck. You just do this by pulling the gray handle. It doesn't lock in place, it should just rest against the patient's shoulders. Research has shown that use of an ITD with high-quality CPR before elevation is essential for best outcomes. An ITD should immediately be placed on a sealed airway before beginning the elevation. You maintain that sealed airway using an ITD with continuous two-hand face mask technique, a supraglottic airway, or an endotracheal tube. Once you have an airway with an ITD and the Elegard's in place, start the timer by pressing the number 2 button and continue high-quality CPR in this lowest position. Use the timer to accurately time this period of priming, which research has shown is essential before trying to pump blood uphill to a raised head. After 2 minutes, the timer will flash. This is your only alert to start the elevation by pressing the number 3 button. Be sure to deploy the Lucas device per your agency's protocol. Agencies that use the Elegard system and mechanical CPR are seeing signs of increased perfusion throughout the entire resuscitation, and they obtain ROSC more often. Because of this, it's important to continue resuscitation on scene for at least 30 minutes unless ECMO is indicated and on standby. Providers have shared this technique to reduce time off chest while applying mechanical CPR. Attach one arm of the Lucas at a time. Start with the side opposite the compressor, start low, and go slow.
My 5, 1, 2, 3, 4, 5.
Announce the handoff. Be sure everyone's ready. Then the compressor takes the other arm of the Lucas and attaches it on their side as the non-compressor checks placement and starts the Lucas. And you'll want to mark the placement of the CPR cup to give an instant visual cue of continued proper positioning, especially with any patient movement. With increased pre-hospital ROSC rates, we should expect to be moving more cardiac arrest patients off scene. Using the soft stretcher should make this quick and easy. Since you've got that accordion fold in place, you can simply pull on the lowest handles of the soft stretcher to pull it out from under the patient. And then lift the Elegard unit a little bit at the patient's waist as you pull on the soft stretcher. This helps to prevent catching on the patient's waist and helps decrease shifting of the patient and equipment. And then when lifting the patient to a transport cot, ensure that the pelvis and the lower extremities remain level. Letting the lower extremities drop below the level of the waist could cause the patient and equipment to shift. And remember to always check your equipment with any patient movement. Users have created this simple recipe for success. It starts with pre-planning and practice. You need to package your BLS airway equipment with the Elegard for immediate access. Make sure that you do high-quality CPR above all else. Place your supraglottic airway with an ITD to get the pump primed. Quickly place the patient onto the Elegard and make a smooth transition into mechanical CPR. Keep monitoring the patient and provide advanced care. And when you pull it all together, it should go like this.
All right, Alex, if you're going to guide down, check responsiveness. You can work on airway for me.
Copy.
Sir? Not responsive. I don't have a pulse. I'm going to start compressions.
Have the airway.
Bernie, can you prepare the Elegard and the Lucas? Okay. Ivan, will you prepare the EMT? I'm going to stop compressions. Ivan will lift up. Bernie, you're going to slide under? Yes. On my 5, 1, 2, 3, 4, 5. And down. I'm going to continue compression.
Elegard is on.
Elegard is on.
Timer is started.
Timer started.
Under the arm there.
Yep. I'm gonna be fine.
Whenever
On
you're
my
ready.
5. 1, 2, 3, 4, 5. Got good Lucas placement.
Hands going.
Start the Lucas.
Okay.
The 2-minute mark, I'm gonna start the rise. 5, 4, 3, 2, 1, rise. Alright. We're gonna extend on 3. You guys ready?
Yep. 1, 2, 3. And again on 3. 1, 2, 3.